Hi everyone, my first Instagram live, and I am waiting for Alana Frank from the Jewish Fertility Foundation to join, and we are going to have a great conversation. So awesome. Here she is. Just a couple of moments. There she is. Technology.
You did it. You did it.
Oh, I'm sweating here.
Yeah,
Okay.
I know. I know. Our kids didn't teach us.
It's true. Apparently, I can't retain that much. So, okay.
Well, we're here. And I know sometimes it takes some time for folks to trickle on, which I see is going to be happening now.
Fantastic.
Why don't we just wait a few more minutes and then we can get started?
Sounds great.
And you had a bar mitzvah or bat mitzvah this weekend?
A bar mitzvah this weekend. So we are very mazeled out.
What was the highlight?
So it was a Zoom mitzvah.
Okay.
Um, and I actually think I prefer that, weirdly enough, because my son didn't have to deal with the performative piece of it, where it
Mm-hmm.
was really just all about the ritual and the tradition and the family.
Yep.
And and we had people from all over the world join us, which was
Yep.
so cool. So people from Israel and Germany and Mexico and, coast to coast, it was just so special.
Well, there is something special because I feel like more people from around the world, people you love, can actually participate. And
Yeah.
then
And
and then for those kids who do not like to be the center of attention, like my child, who is 9 and has been worrying about it for years, I feel like this is actually a nice, interesting option.
yeah, the other
Um,
plus is my father was unexpectedly hospitalized the weekend before. So this was a way he was still able to participate,
mhm.
even though he was in a hospital bed. But he's doing great. He's doing okay. And we look at it as a blessing because
Mhm.
had he not been hospitalized, we would not have learned of a larger problem. So,
Okay.
yeah.
Well, there you go. All right. So we're going to get started, and I'm sure more people will join. And if not, then people watch our recordings afterwards.
Totally.
So awesome. All right. So welcome to Taking Politics Out of Abortion with Dr. Julie Bindeman. Am I saying your last name right?
You
Bindeman?
are. Nailed
All
it.
right. I'm Ilana Frank. I'm the CEO and founder of Jewish Fertility Foundation. Like many of us in this space, it is personal. My 3 children were born via IVF, two of whom were born in Israel. And I was very, very lucky because they were conceived in the wonderful world of socialized medicine. So I didn't have to pay for them. My taxes and my insurance paid for them. And then my third child came after a little bit longer of a struggle via embryo donation. And I was very lucky to carry him myself. It was a hard journey, and we're lucky, for people like you who help us with the mental health side of it. So thank you. So what does JFF do? JFF does 3 main function areas. The first is that we offer financial assistance by way of fertility grants from $1 to $15,000. And we also offer a 20% discount for all of the clinics that we partner with. So we're a community-based organization, and right now we're local in Atlanta, Georgia, and Cincinnati, Ohio. But one of the reasons I'm so excited to talk to you is because we are expanding, and potentially in the near future we will be in the DC, Maryland area. So kudos to all of us. And I went to school, University of Maryland, so love those people.
Go
Um,
Terps.
Go Terps. So again, money is really, really important, and helping to figure out how to pay for your treatment is hugely important. But we also understand that the emotional toll of infertility is really, really hard. And I know personally, I always talk about my husband and just the relationship, between us was hard, and I'm sure it still trickles even though we have children today. but also just, talking about it with your family and friends and just dealing with your own sanity while you're going through this. So we, as at Jewish Fertility Foundation, offer traditional support groups. Again, everything we do is community based. Of course, during COVID, everything is virtual. Additionally, we offer a fertility buddies program, which is where we match veterans of infertility up with people going through it today. They're not your friend, they're not your therapist, but they're there with you along the journey. And all of our emotional support is free and open to anybody, regardless of religious background. And then the last thing we do are educational trainings, kind of like tonight. We also go into fertility clinics and train the doctors and the nurses and the admin staff around special needs of Jewish clients. And then we do trainings like panel conversations around pathways to parenthood, how to become a parent, and in various different ways, as well as loving someone with infertility, which is where more our mental health providers and rabbis come together to share tips and tools on how to get through this and how to share with your loved ones, best ways to support you. So we are super duper, again, excited to have you on today. Our community really wants to get to know you and also really to learn about the topic at hand. And this is a super duper sensitive one and emotional, and it comes with lots of emotions. So why don't we start with you? Who are you? Tell us a little bit about yourself.
Sure. So my name is Dr. Julie Bindeman. I am a sixth generation Washingtonian, and yet none of us are involved in the federal government. So I feel like that in and of itself is like a badge of honor. Um, I am a reproductive psychologist. I'm the co-director of a practice called Integrative Therapy of Greater Washington. And I am a proud, again, I said sixth generation, but that also means I'm a sixth generation at my synagogue, which is Washington Hebrew congregation.
Wow.
So that's pretty cool too. And my son, who just was bar mitzvahed, was seventh generation, which is super duper cool. So I, like a lot of mental health folks, came into this field, as I like to say, really honestly. I remember in graduate school, my teachers had said that your niche will find you versus you finding your niche. And that was certainly true with me. And I feel like the universe kept on giving me hints, but it needed to like bang me over the head before I really got it. So I will speak about my story in a little bit because certainly it is one of the ways that I come to talk about abortion. And so, yep, there I did it. I said it. It's the A word,
Yes.
abortion. Maybe we should all just try to say it like 3 times. I promise nothing will come from it, but just practice saying it. And I know that sounds sort of a silly thing to do, but we look at it as this unmentionable word. It's like cancer, but it's not. And the more that we can name something, the more we can tame the feelings we have around it. So if you can name it, you can tame it. That goes with all kinds of feelings, but being able to say something controversial like abortion or I had an abortion is something that can be like a family stopper in a lot of ways. People kind of look at me
Yeah.
when I say, like, yeah, I had an abortion. Like, wait, what? Yeah, someone who's had an abortion because 1 in 3 women have had an abortion at some point in their life. And a lot of those women might have already been mothers at the time they had their abortion, like I was. I was a mother when I had my abortion. And that's not a way we think about it. We have a really narrow idea. I think it's sort of a way we feel better about abortion is we like to kind of other it that yes, let it be rare, let it be safe, but let it not be for me. And what's really interesting about it is abortion is not rare. And certainly with American politics, it might not be safe. So these are really important kinds of things to consider. Abortion is healthcare. So I can kind of back up because there's a lot of different reasons why people might choose abortion. And it might seem really weird to hear me say something like, I had a fertility journey and it involved 2 abortions. And that doesn't make sense on its face to a lot of people. But both statements are true. I had a secondary infertility journey and it involved 2 abortions. And I look at those abortions as the only way I was able to create my family. So for me, it was vital health care. And again, I promise
Okay.
that's my teaser. I'll talk a little more about my story too.
Okay, so why are people getting abortions? Can you tell us a little bit more about that?
Absolutely. So abortions happen for all kinds of reasons. Abortions might happen because, oh my gosh, the birth control I used failed and
Mm-hmm.
I'm not ready to parent, or I'm not ready to parent again. And so I need to end this pregnancy. Other reasons why people might have an abortion is um, I wanted to get pregnant, and we learned at 9, 10, 11, 12 weeks, whenever we might have had one of those early kinds of screenings or testings, that oh my gosh, the baby has a chromosomal issue going on and we
Mm-hmm.
don't feel like we can parent it, or it's a chromosomal issue that's not compatible with life. Another reason people might choose abortion is they might have wanted to get one earlier, but because of state limits and
Mm-hmm.
gestational limits and the cost of it and transportation and trying to get off of work, it might have pushed them later and later into their pregnancy before they were able to seek out an abortion. And of course, that just makes the cost more, that just makes the actual procedure take longer. So, as I'm saying, vital health care here. People might have an abortion because they didn't even realize they were pregnant. And when they learned they were pregnant, they had just had surgery and were under anesthesia while they were also pregnant, or might be taking like really potent pain medications, might be taking a medication that's incompatible with pregnancy. And so they might choose abortion that way. They might choose abortion because they, again, didn't intend to get pregnant and they're on some kind of medication that they can't stop because of whatever physical or mental health kind of issue they might have, but also is incompatible with a healthy pregnancy. So that's another reason people choose abortion if they learn they have a cancer diagnosis during pregnancy. So there's no one reason to choose abortion. And I think from the examples I give, all of these reasons are the right reasons for that person. And so it's not up
Interesting.
to me to judge whether a person
Mm-hmm.
should or should not have an abortion. But it is important that they get good information about it. And everyone who has an abortion has a different emotional reaction to it. So there's not like one reaction, and there's so much mythology around it that if you have one, you're going to have cancer or you're going to have infertility. Both of those are lies, just flat out lies. The research does not support it. And I think there's also a myth too about if you have an abortion, you're going to regret it and you're going to have once again, a lie, but called post-abortive syndrome. Not a thing. Um, and so there's a mythology about that
Mm-hmm.
too, about how people feel. There are people who have abortions and it's the best thing they did. And they are grateful for it from the time they walk into the clinic to the time they walk out. There are other people who have abortions and that's not how they feel. And so there's not one right way. However you feel about whatever circumstances you're in is how you feel.
Can I ask you a question? What is an abortion? Like, what actually happens in the doctor's office?
Absolutely. So, an abortion, first of all, it's a medical term and it means the removal of a pregnancy. So, interesting side, if you have a miscarriage and you read your medical notes, it will say that you had a spontaneous abortion, which
Mm-hmm.
really like flips people out because they're like, "Oh, I did not." Well, yeah, you did. You had a spontaneous pregnancy loss, and it needed in some way, whether it was a your body removing the pregnancy or whether it was some kind of surgical removal or medication removal, but somehow the pregnancy needed to exit your body. And I'm saying this in a really coarse way, and that might not also sit well with people. So I want to acknowledge that. I'm talking about this from a really medical perspective right now. And our medical language is not pretty. Our medical language is not flowery. It's not comforting. I wish it was different, and I think we can probably work on that as well. So abortion can look a lot of different ways. It can be as simple as taking two different sets of pills. One pill that's going to induce contract, or one pill is going to actually stop the growth of a
Okay.
developing fetus, and another pill that's going to induce contractions and cause the uterine lining with the fetus to shed. That is something that you can do at home. It typically takes about 24 hours from start to finish. Different people express different amount of pain around it, and pain is really subjective. So for some people, they're like, yeah, it was like period cramps. For other people, they're like, oh my God, it was going through labor. Um, so I don't have a way of sort of saying to people, this is what it's going to be like for you. Um, so that is on one end. And even during COVID, the restrictions around that was you had to have an in-person visit for a doctor to prescribe that.
Wow.
Really crazy to me. Um, and so that's one way. Another way is something called a DNC, a dilation and cutterage. And so that is an outpatient procedure. Oftentimes it can be done in your physician's office. It can be done at a clinic. It can be done in a hospital. And it is, a lack of a better way, is kind of like a vacuuming almost of the products of conception of the pregnancy. It can involve a little bit of scraping of the uterus to make sure that there's no placenta that's attached to the uterus, which unfortunately is really important because if you leave placental material onto the uterus, there can be future complications in pregnancy. It can cause adhesions, it can cause scarring. So we want to make sure that there's nothing that's left,
Mhm.
nothing that's remaining. Um, as we get further along into pregnancy, the methods change. So a DNC tends to be used up until about 14-ish weeks. The medication abortion the medication tends to be used up until about 10-ish, 11-ish weeks. And then the next step up is something called a D&E, a dilation and evacuation. And so that is more invasive than a DNC. It tends to be for people that are past 14 weeks gestational age. It requires skill to be able to do it. It can be done in a clinic in an outpatient setting. It can be done also in a hospital. It tends not to be done in a doctor's office because this tends to require anesthesia. A DNC doesn't have to require anesthesia. It can require kind of a light sedation instead of. Um, then if we
Yeah.
sort of move up to another level, you can induce abortion at second or third trimester in pregnancy, as a pregnancy has progressed to its later stages. And you can do this of one of two ways. You can do this by dilation, and there are seaweed sticks that you use to dilate the cervix. And then oftentimes there'll be a shot that will stop the baby's heartbeat so that it will be a spontaneous, you'll go into labor because of the seaweed sticks. And you'll just have a labor and delivery. You can also, in later parts of pregnancy, you can be induced just like you are
Yeah.
with healthy children, but the induction looks a little different. It's medication that is inserted into your uterus to help you dilate. It's not Pitocin because until the later end of the third trimester, the Pitocin receptors haven't even developed yet. So it's a really different procedure, and people will do that because they want to make sure that they want to spend some time with the baby that they've lost. It can help to bring closure, and this, as I said, happens later on in pregnancy, second trimester, third trimester as a possibility.
Well,
That was
thank
probably
you.
a much longer answer than you were looking for.
I think it's important for us to actually understand what is involved in the process.
Yeah.
No, that was thank you. So tell us a little bit more. Judaism, we are the Jewish Fertility Foundation. What do you know about the Jewish approach to abortion?
The Jewish approach to abortion is super interesting. And I remember having conversations with my rabbi being like, can I even do this? And she was like, yes, you can. So two of the principles that Judaism have that make abortion kosher, if you will. The first principle is that Judaism doesn't believe that an embryo becomes life until 40 days post conception. Up until then, it's considered to be water. And so if you have an abortion, you're not doing anything. You're not killing a life. You are just getting rid of water. It's not a life. The other piece that's really interesting too in terms of Judaism is that there's some disagreement in terms of when a fetus becomes ensouled. So there are rabbis and people who speak about it that it occurs during pregnancy, and there are others that speak about it at first breath. Which is after delivery. So that's another sort of point of contention because God forbid we Jews agree about anything, right?
Mhm.
But the other part with abortion that's really interesting too is that anything to save a mother, whether it's her physical health, which again could be a reason a woman seeks out abortion, or whether it's her mental health, um, is legitimate grounds in which to save a mother. And so those are reasons in which a person could have an abortion. Fetal anomaly is also kind of lumped into that as well as you get into later teachings.
Mhm. Interesting. So, you hinted to this before, but I think especially, I'd love to learn a little bit more if you're open to it about your own personal experience around abortion.
Absolutely. So I remember I got married at the ripe age of 25. And our deal was that we were not going to start having kids until I got licensed, which I was finishing grad school, and just getting licensed to be a psychologist is its own ordeal. And so my husband's like, I know you. If you don't get licensed first and we start having kids, like it's just never going to happen. And, we've invested too much time and money in your education to not have you be a psychologist. I'm like, all right, that's fair. So we stopped birth control, and we
Hmm.
are one of these families that are really annoying and really not normal. So let me own that we are just a pretty fecund couple. And so we stopped birth control. We sort of started our first month, and I found out I was pregnant. And I was super lucky to have this really uncomplicated, really boring pregnancy where my son, who just became the bar mitzvah, was born at exactly 39 weeks and 6 days. Like, you could not be more on time. He came on Erev Yom Kippur, which meant I got out of services, which was awesome. Um, but it meant that my OB had to switch out because she's like, gotta go,
Yeah.
which happens. So that was great. And he was a great kid, still is a great kid. And when he was about a year and a half old, we were like, you know what? He's a great kid. We should have more, which I think a lot of people feel. And I was pretty certain that if we started then, it was going to take us a while because it was weird that it was so fast. So we started again. And oh my God, I got pregnant that same month. And my husband started to get a little annoyed because he's like, hold up, the fun part of this was supposed to be trying. You told me we were going to have like a lot of trying. I'm like, I don't know. Um, and I was really heartbroken when I learned when I was 8 weeks along and I went to the doctor and I was measuring at 6 weeks with no heartbeat. And that was just devastating. What was interesting is that I'd known so many people who had had miscarriages and yet hadn't had one myself, and I didn't get it until I had one myself, that like this was really a loss of potential. And that was, as I said, just heartbreaking. And so we were told, hey, just try again. Miscarriage happens, it's really common. So we're like, okay. So we tried again, and I had like a shorter cycle, so I kind of didn't think anything of it, did our thing. And, I was like, oh, cool. I think it didn't work this month because I had started to bleed. I'm like, that's awesome. We get to try another month. So I was actually like excited. I'm like, yeah, it didn't work. I didn't think anything of it. And I'm like, all right, cool. It was like a little bit of spotting, no big deal. 2 weeks later, like I really started to bleed. And I'm sorry if this is too much information for people. I was at my office, and in between clients, I had a break, And I'm like, what? I had a period 2 weeks ago. What? So I called my doctor and they're like, take a pregnancy test. And I'm like, no, I'm not pregnant. That's just not happening right now. So I went to the grocery store, grabbed a pregnancy test, went into my bathroom, took that test, and was super duper surprised when those two lines showed up. And again, how do you have a positive pregnancy test and you're bleeding? Like what do you make sense of that? You're like, oh
Hmm.
God, I'm miscarrying. I must
Right.
be miscarrying. So I'm frantic and I call the doctor and they're like, we can see you tomorrow. And I'm like, oh. And that night the bleeding just increased and I am so convinced I'm miscarrying and I'm just devastated. I go into the doctor the next day and they take my blood, which of course is going to tell me very little until they have a second blood test. And I plead with them. I'm like, can you please just use the ultrasound machine? Like I can't, I need to know. I just can't manage the anxiety of not knowing. So they sent me up to radiology and I was able to get scanned. And when I spoke with the doctor, she's like, okay, here's the deal. You're pregnant. Like we see the gestational sac and you have something called a subchorionic hematoma. And I'm like, oh, wow. And she's like, it's not uncommon and it's a bleed and, we're just going to monitor you. So I kept on going back to the doctor each week and the SCH got bigger, which of course freaked me out. And um, the baby kept on growing. And like next thing we saw was a heartbeat. And next thing, I'm like, okay. So I was on bed rest for about a week. And when I went back, the SCH had gotten absorbed. They weren't sure if maybe I was carrying twins or not. But at this point was just having a singleton. So I went through the rest of the first trimester feeling so sick and, trying to hold on to that as like, well, this is a good sign, even though I wasn't that way with my son. And so I was like, okay, we're getting through this. All of my testing and screening came back great. I was psyched. I got through the first trimester, started telling people about it, progressing into the second trimester, still getting all the screenings. Everything's looking amazing. I'm starting to talk to colleagues about what do I do about my practice? If I'm pregnant, how do I tell my clients? What do I do for a maternity leave? How do I plan these things? And we get to our 20-week ultrasound, and it happened to be the Friday before Thanksgiving. It was my husband took off of work, and we get to the doctor's office, and they're like, oh, we can't see you. You had too many ultrasounds. Insurance won't cover this one. So you have to go to a radiologist. And I'm like, all
Ugh.
right, just get me the appointment then. So
Hmm.
they're able to get me in that day. I'm like, great. So we went and we're just chatting and we're talking to the tech who's doing my scan. And she's like, do you want to know what you're having? And I'm like, is there any other point to this ultrasound? Yeah. She's like, oh, you're having a boy. And I remember like a tear fell from my face because I was like, damn it. I was hoping the nausea meant I was having a girl. But fine, whatever. I guess this means we'll have a third because, we'll try for a girl then. And I remember saying to the tech, like, does the radiologist want to come in? Does he have anything to say? And she's like, no, 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 just go back to your doctor. And it was this really pleasant conversation we had all during the scan. So we went back to the doctors and we got ushered into the doctor's study, which is really never the place you ever want to be. And the doctor walks in and she looks at us and she's like, I'm so sorry. And I looked at her and I said, so it's another boy. That means we'll just have to try for a third. And
Mm.
she looked at me like I had two heads or something. And it dawned on her that we had no idea what she was about to tell us. So she says, oh, they didn't say anything to you. And I'm like, say what? She says, well, it seems from the ultrasound that your son doesn't have a brain or part of it's missing. And I'm like, what are you talking about? And I'm like, well, with neuroplasticity, it can grow back. I want to get it. I start going into like psychologist mode. And I kind of look over at my husband who's tearing up and he is not the crying kind of guy. And I'm like, oh, this doesn't seem good. And can't come in. Um, Sorry about that. That's when life interferes in a pandemic. Um, and I learned that, like what do we do? So we were told to go get a second opinion. That was arranged
Mm.
that afternoon. I was a sobbing mess. I had a friend of mine who was working with me call my clients to cancel the afternoon, told her what was happening. And we got our second opinion, and they started throwing around all sorts of medical terms I'd never heard before. They started talking about the hydrocephalus, which I had understood, and then they started, which is water on the brain, and they started talking about enlarged ventricles, which was causing the hydrocephalus. Um, and I was like, wait, what? So they were able to arrange for us the next week to go down to a children's hospital so that I could have a fetal MRI. Those are really small tubes for grown-ups, I must say. So I had
Mm-hmm.
a fetal MRI, and we had back-to-back meetings with genetics, with neurosurgery, with everybody, just to get a sense of like, what are we even looking at? What does this mean? What is prognosis? And I remember we're sitting in this room with all these doctors, and we're having this conversation. And I'm like, all right, what's he going to be able to do? And they're like, well, at this point in time, his brain ventricles are measuring over 2 centimeters. Just for context, 1 centimeter is the top end of normal. So we are talking about something that is way beyond what is normal expectations. And because of that, the cerebral spinal fluid wasn't able to drain into his spine, and it was causing an excess of fluid in his brain, causing the hydrocephalus. And we're just devastated. And they said, best case scenario, should he even survive to term, which we can't promise, is he'll have the developmental quality of life of a 2-month-old. And they start talking to us about these chairs he could sit in as he gets older, because he could live into his 40s or 50s, that he would never feed himself, he would never speak, he would never walk on his own, that his whole life would just be basically confined to a chair. And we started thinking about our older son and couldn't imagine what that would be like for him. And so we spoke with our parents, and then we called our rabbi and had a long conversation with her. And she said to me really clearly, this is okay. Because one of the options we were given, we could carry to term, or we could choose to have an abortion. And when this all happened for us, it was 6 months after a man named Dr. Tiller was killed. And I remember seeing the report on CNN, and I remember being like, gosh, I don't even know why people would have an abortion in their second and third trimester, but you know what? It's not for me to judge. So, okay. Um, and that's when I learned, this is why people have abortions in their second and third trimesters.
Wow.
It's one of the reasons, I should say. And so because Dr. Tiller was killed, the abortion care in my state, which is a state that has great abortion care, ended like overnight. So all of the places I could go, University of Maryland Hospital, Johns Hopkins, no longer accepting patients like me. And so my choice, if I wanted to have a surgical abortion, was I could either drive up to New Jersey, or I could labor and deliver at my home hospital and have my OB do the labor and delivery. And since this was going to be right after Thanksgiving, we chose to stay home so that at least we had family who could be with our son, and family who could come and visit us. And I labored and delivered in the hospital. And it was awful. And I was discriminated against by one of the nurses that was supposed to be caring for me in just some of the treatments she did. She withheld care that she should not have withheld. I learned this all later, of course, but
Sure.
um, just did not seem to agree with what I was doing and should not have been put in my care, because it just adds insult to injury for me. So we went after this, and we kept on asking, like, do we know why? And the doctors were like, this was a fluke. Don't you worry. You'll get pregnant again. It'll be fine. We'll monitor you every 2 weeks, but you'll be fine. So we're like, okay. So as soon as I was able to try, once my period came back, which by the way took 4 months, and after I delivered, my milk came in, so it was like full on, as if my body thought I had a baby.
Mm-hmm.
But I came home with empty arms. And so we tried again. And as I said, we're the weird couple that is fairly fecund. So we got pregnant pretty quickly. And this entire pregnancy, I was super duper nauseous and probably had hyperemesis and was terrified. I was terrified I was going to miscarry in the first trimester. I was terrified we are going to find this brain abnormality. I go at 15 weeks to the doctor. My mom was with me, and the nurse who was scanning me is like, "Oh, I don't like what I'm seeing. I don't see X." And I'm like, I just like lost it. And I demanded she stop the scan, and I demanded the doctor come in. And the doctor, when she looked, was like, well, that's weird. She had it on different settings than what we typically use. Like, I get what she was saying, but I'm not seeing it when I adjust the settings, and everything looks fine. And then we went in 2 weeks later, and the doctor did her scan, and then the genetics counselor came in. And I looked at her and I'm like, uh-oh, it's not good as she's coming in. And she's like, well, and the doctor's with her, and she's like, we're seeing that the ventricles are sort of trending a little bit past that 1 centimeter mark. And, you're only 17 weeks, so it's earlier. We're cautiously optimistic, but we want you to go down and have an MRI. And like, that was so not my plan. I was like, if I never have to be in that tube again, perfect. So we went down the next week. I was 18 weeks. It was the earliest they could get me in. I had the MRI. It showed hydrocephalus, it showed ventricular megaly, same as the other, and it showed partial agenesis of the corpus callosum, meaning that the two parts of the brainstem weren't connecting. So I heard all this and I'm like, ooh, it's different. And the radiologist looks at me and she goes, no, actually it's the same. We're just catching it earlier. And so it's not as advanced as the other one was, but it's the same. And I was part of the sadness for me was that I was pregnant with a girl and I was convinced that I was never going to have a daughter. So we chose to terminate. And this time, because I was inside 20 weeks, I was able to go to a DC hospital and have a D&E. It was like almost 180 from my other experience, where the doctor was the most compassionate human being I've ever met. And his bedside manner and follow-up care were just tremendous. And we keep in touch even to this day. Wow. And the doctor who performed my first abortion, we keep in touch too. She was great. It was just the rest of the hospital, not so much. And so I was devastated. I now had 2 abortions in less than a year's time, both in the second trimester. I had had a miscarriage before that. And I started to think that my son was the anomaly, that, maybe I'm not meant to have kids. And we started to think about like, well, is this a genetic thing? Because there was they're like, this could be dominant. And like, they did a bunch of MRIs with my husband and his family, and they found like, no, it's not. And they're like, all right, it's most likely recessive. We can try to find the gene, but they weren't able to find anything. Or at least whatever they found, it wasn't known yet. So possible in the future, they'll know it. And so we were basically like, all right, well, if we can't find the gene, just get pregnant again and we will monitor you and you'll have an MRI at 18 weeks and we'll see what we see. Because I'm like sitting here being like, okay, I'm going to have a surrogate and I'm going to get pregnant at the same time. And we'll sort of see which one of us, and like totally not realizing that like, no, that's a horrible idea. Because I'm just trying to be like, how do I get my baby ASAP?
Yep.
And so 2 months later, I get pregnant again, and I am like white knuckling my way through this pregnancy, and I'm not sick. So of course I'm like, well, I'm not pregnant then. And I get through the first trimester and I get through all the testing and everything's looking great. And we go for what is now for us a normal 18-week MRI, because doesn't everybody get that?
Sure.
Right? And so we went for that, and they do the MRI first, and then afterward I was having a really like deep ultrasound, which crazy the technology they have. And so as I was having the ultrasound, the radiologist pokes her head in, same person I've met now, like this is the 3rd time. She pokes her head in and she's like, hey, I'm sure you guys are freaking out right now. And I'm like, just a little bit. And she's like, I just wanted to let you know everything looks great. And I'm like, I'm sorry, what? She's like,
Hmm.
everything looks great. And I said, all right, is it still a girl? And she's like, yes, it's also still a girl. I'm like, okay. Um, but I needed to see. I went into her office afterward and I said, show
Right.
me this baby, show me the others. I need to see. And it was clear as day. And I'm not trained as a radiologist, but it's clear as day what the differences were. And so I really credit my abortions brought my daughter to me, who is now a healthy, almost 9.5-year old, and just such a light to our life. And, I had this whole idea of, oh, well, we talked about three. So my husband's like, all right, are you going to be crazy? Because if you're going to be crazy, because I mean,
But how
what?
are you not crazy if
Right.
you've gone through that before? How possibly are you not?
Right. Totally. You're so right. But that doesn't mean it's easy to live with.
No.
So I understood his point, and I'm like, at this point, I'm happy with our family. If it works, it works. If it doesn't, it doesn't. And I can be fine either way. But I just want to try one more time. And so we tried. And, at this point, it was like, all right, well, we go in for our MRI, no big deal. And, it was such a different experience though, because I wasn't nervous. And we were just like chatty and like, they're like, all right, you need to do this. I'm like, yeah, I'm a pro at this. This is my fourth. I got you. Um, and it was interesting because we saw other couples there who were confirming other diagnoses, and that we were just in such a different space. So I was able to sit there and be like, hey, here's my name and my information. If you want to talk, happy to talk. I know what this is like. And so, like, it was just really interesting to be in that place in such a different headspace. And so we went in and we learned like our baby was healthy. Um, and again, so like that's when I sort of sat there and I looked at my husband. I'm like, oh, we're actually having a third, huh?
Yep.
Like, what's that going to look like? Um, and our joke was, well, if we have three, we can get a minivan. So he's like, oh, it means we get a minivan. I guess so. So
Wow.
that, as I said, that's how I came to this field. I came to it honestly. I had secondary infertility with recurrent pregnancy loss, and I had abortions. And all of that was part of my infertility journey.
That was a lot. Thank you so much for sharing. I mean, that I can understand why you're probably such a good mental health provider. You can connect in ways that many of us can. So again, thank you so much for sharing. Um, wow. Okay. Sorry.
Yeah,
Normally, yeah, these are not normally as,
it's
emotional.
intense.
It
And
is. It's really intense, and it really, we've all obviously been through stuff, but thank you.
no, we've all
All
been through
right.
different stuff,
Yeah,
and I don't need to make a contest with anyone. Like, all
absolutely.
of our stuff sucks. Period.
Okay. So, thank you for that today. Is there anything else that you would like to add before we close about abortion in general or
Yeah.
abortion as healthcare? Please share.
Yeah. So what is so crazy is that, especially with the recent justice on the Supreme Court, the right to abortion, which is still a right in all 50 states, is really being threatened. There are cases that are winding up to the Supreme Court, and I imagine that if they are heard or when they are heard, um, our abortion rights are really going to change. And some states include abortion as part of
Hmm.
their state constitutions. So in those states, it won't change. But to have, again, this really normative kind of healthcare, I mean, abortion is used all the time in fertility treatment, that if you have a higher order multiple and that's a danger to you to have it, selective reduction, it's kind of a nicer name for abortion, but it's an abortion. And so we try to kind of cover it with different kinds of names because we're so afraid to say that word abortion.
Right.
But abortion is not a bad word. It has empowered me in a way I never dreamed of. I have become an advocate for reproductive justice, and that has given me so much power. And so it's not to say that that has to be everyone's journey, but certainly it is one way that you can do it. And so don't be afraid of abortion. Abortion is not a bad word. Abortion is healthcare. And while abortion might not affect you, it definitely has affected someone that you love.
Thank you. Thank you so much for your time. Thank you for you all being a great audience and listening. Again, we are the Jewish Fertility Foundation, and our next event is on November 22nd. We are going to be having a Pathways to Parenthood webinar where we're going to be hearing from REI doctors, infertility and adoption therapists, social workers, fertility attorneys, adoption agency directors, individuals who have personally gone through the process of IVF, IUI, sperm, egg, embryo donation, surrogacy, and adoption. This is your opportunity to really learn more about the multiple pathways to parenthood. You'll need to RSVP for this one on JFF's website. Again, thank you so much for being so candid and so open. And honestly, I've learned a lot, and I'm glad to know you. So thank you so much. Have a great, great, great evening, everyone.
Thanks everyone for tuning in. Bye.
Bye.